So about 3 years ago, I started taking an improv class. I had no clue that it would lead me into better communications with my patients. There are 3 things that you learn in an improv class, but the first thing is that you have to walk on that stage with a totally empty mind. Once I was in a class and we're doing a scene, and there were two scene partners, and they were parents at a race for their kids at a track meet, and I came out fully prepared to be another parent. But when I got out there, they said, "Oh, look, it's the coach." So right then and there, I had to become the coach. I couldn't be the parent because, I had that in my mind. I would have screwed up the scene. That's how you're supposed to walk into a room with a patient. Totally empty mind. Don't think you know anything about them. When my first day in derm residency training, the old professor sent me into a room and he said, "Greenberg, go look at this patient who has herpes simplex," or something like that. And I walked in and I looked at the patient. I didn't know jack about dermatology that first day. And I looked and I came out and I told him everything I knew about herpes simplex. And he said, "This is your first lesson." He said, "That patient has something totally different." I forget what it was. Don't ever listen to what anybody tells you about what a patient has. Go in with an empty mind. Second rule of improv, you are only on that stage to support your scene partners. There are no stars in improv. There are only constellations. So when you walk into a room, it's about the patient. It's not about you. Third rule of improv, it's called yes-anding. I happen to have a yes-and tattoo right here on my arm. Yes-anding means you agree with everything said. So if you're doing an improv scene on stage, and it's happened to me, and the audience suggestion is Hawaii, and my scene partner tries to fool around with me and says, "Look at those polar bears," I have to agree that there's polar bears in Hawaii. That means when you go into a patient's room and they say something totally outrageous, you agree with them, yes-and them. And let me tell you how that works. This is a true story. I walked into a room with a patient, and he said, "I only want natural therapies on my eczema," and he was about a step away from being hospitalized with infection. I said, "Oh, that's cool." I said, "I've been studying medicine for about 40 years or more, and I've never seen a human body make what," he told me he was using lavender and thyme oils. "I've never seen it make lavender and thyme, but I do know your body's making cortisone right now. So maybe cortisone is more natural to you than that lavender and thyme. And how about we give some more natural cortisone-type lotion to your skin to stop the eczema rather than lavender and thyme?" He said, "Oh, cool." In our practice, we have a number of us partners who have taken improv training. And yes and works because improv schools go out to industry and practices like ours and teach this technique of yes-anding. And it's amazing when a dumb idea floats out at a board meeting, and instead of saying, "That's the stupidest thing I ever heard," we go, "Yes. And if you added this, it would look like this. Yes, and if you did this, yes." And all of a sudden, the dumbest idea in the world becomes something brilliant by yes-anding. So by yes-anding your patients, you get to be part of them. So when you're dealing with patients, how does this sound differently? You should have this, and you should have that, and you should have an excision here, and you should have that. Instead of saying what I say with patients, "Well, these are your options." The lady came in, this is the other day, the lady came in and she had a very small cyst on her face, and she didn't like it. And I had her hot compressing it at first. And she said, "What do I do here?" I said, "Well, you could have it taken out, send you to a plastic surgeon, or you could just leave it alone. Or you could continue to hot compress it. You said it makes you better. You have all the coulds." And when you say could instead of should, when you say should, you push somebody away. You got to do this. We immediately get our defenses up. When you say could, you bring them in to the relationship with you. And that's what improv teaches us. It doesn't just teach us how to talk or how to make changes like this. It teaches empathy, all right? Empathy goes a long way toward helping your patients feel better, about themselves. We learn a lot in this meeting about where to inject and what medicine to give, and all that's great. But you got to balance that, on the other hand, with keeping your heart open, because you're really there. People come to us, they're saying, "I'm scared I'm getting old. I'm scared I'm not going to be loved." And if your practice is just about doing the procedures, you're missing out on half the fun.